Welcome back to my channel for another video, this time on echocardiographic evaluation of perimembranous ventricular septal defect. Ventricular septal defect is the commonest form of congenital heart disease in children and adults. We will see which are the types of ventricular septal defect other than perimembranous ventricular septal defect before we go into the echocardiographic evaluation of perimembranous ventricular septal defect. This is a public domain image from Centers for Disease Control and Prevention, United States of America, showing the heart in general, superior vena cava, aorta, main pulmonary artery, left atrium, mitral valve, left ventricle, right ventricle, tricuspid valve, showing various types of ventricular septal defects. This is slightly enlarged cropped image of the same image which was shown earlier, and this shows the positions of ventricular septal defects more clearly. This is the outlet VSD named as 1 here, and this is the standard perimembranous ventricular septal defect number 2, and here is the muscular ventricular septal defect. It need not be exactly in this position, it can be anywhere on the muscular portion of the interventricular septum. And this is the inlet VSD, which is often seen in endocardial cushion defects, that is near the tricuspid and mitral valves, and it is usually associated with abnormalities of mitral or tricuspid valves, so that there can be mitral or tricuspid regurgitation. It is often a part of endocardial cushion defects. Of these VSDs, outlet VSD, which is also known as subpulmonic VSD or subarterial sometimes, and inlet VSD are very unlikely to close spontaneously. Perimembranous VSD, which is the commonest type in an adult or older children, can close spontaneously by two mechanisms. One is aneurysm formation, second is attachment of the tricuspid septal leaflet to this defect, so that there could be associated tricuspid regurgitation then. And muscular VSD, which are often very small, are the most likely to close spontaneously by ingrowth of muscle. Muscular VSD closes more likely. So these are the different types of ventricular septal defects, and we will go into echocardiographic evaluation of perimembranous ventricular septal defect. Parasternal long axis view showing right and left ventricles, left atrium and aorta. Perimembranous VSD is seen just below the aortic valve. It is subaortic in location. Size of VSD is compared to the aortic diameter. Here it is a small VSD, as it is less than 1/3 of aortic diameter. Still frame from parasternal long axis view in perimembranous VSD, showing the color jet from the subaortic region of left ventricle to the right ventricle. Color sector in parasternal long axis view shows the mosaic multicolored VSD jet across the perimembranous VSD from the left ventricle to the right ventricle. It is a high velocity jet because VSD is restrictive. The neck of the jet almost corresponds to the size of the VSD. Perimembranous VSD jet on continuous wave Doppler interrogation. It is a high velocity jet indicating large gradient between the ventricles. High velocity jet is noted in restrictive VSD. Small VSD is also known as Melody the Roger. In large VSD, the gradient is low as the pressure in the ventricles equalize. Apical 5-chamber view showing the subaortic perimembranous ventricular septal defect. Sometimes it may be associated with aortic regurgitation, though not seen in this case. Color Doppler imaging in apical 5-chamber view showing the left to right shunt across the subaortic ventricular septal defect into the right ventricle. Still frame in apical 5-chamber view showing the VSD jet.